Okay.
Ladies and gentlemen, good morning, good afternoon, wherever you are. My name is Lambert Mbom. I am a freelance journalist based in Washington, D.C., and I'm the Executive Director of the Southern Cameroon's Medical Society. Welcome to our fourth edition of COVID-19 and Africa, and today we'll be celebrating nurses. It is the International Year of the Nurse and Midwife as declared by the World Health Organization. And World Health Organization ranked nursing as the most trusted profession. Today, we want to celebrate the great work, the great efforts, the great sacrifices that nurses across the world are making in order to keep us safe, in order to restore our health. Very often, in the midst of a pandemic like this, the temptation is to celebrate the scientists, the doctors, but the people who actually do the hard work, the nurses, are often left out. Across the world, different countries, even here in the United States, we have had experiences of nurses. Every time they have gone to work, they have had people deliver food to them. They have had people, stand up at night. There have been shout outs different ways. This morning, we want to celebrate the lives of one of our nurses. I'm very privileged, very honored, and flattered to have with me my dear friend, Mrs. Judith Kibu Ballon. I have known Judith for over 10 years, and we belong to the Cameroon Catholic community here in the Archdiocese of Washington, D.C. She was there from the beginning and has been playing a leading role in the community. She is a nurse. She's also the executive director of the Holy Trinity Choir. Um, I reached out to Judith a couple of days ago. I'm looking for nurses. I wanted to share the story of nurses who are on the front lines of the battle against COVID. And I would have loved to have somebody who has experienced COVID. And experienced COVID could be at different levels. I'll let Judith introduce herself and then we'll take it from there. Welcome, Judith.
Thank you, Lambert. Good morning, everybody. Like Lambert said, I am Judith Kibu Ballon. I am a registered nurse here in the state of Maryland. I started my nursing career in 2009 in Houston, Texas. I currently work in an ICU in the second busiest trauma center in the state of Maryland as a nurse manager. I am a COVID-19 frontline healthcare worker, and I am also a COVID-19 survivor.
So thank you again, Judith. Like I said, I am really today want to celebrate you. And in celebrating you, I'm celebrating all the nurses. I would have loved to have 2,000, 1,000 of them on this show,
Thank
but
you.
you embody what nursing is all about. I will get
Thank
to
you.
that in a minute. I just want you to share with us what is an ICU unit and what has been the role of the ICU unit in the face of this pandemic.
An ICU or intensive care unit is a critical care unit. So the patients that require ventilator support or additional respiratory support, or patients that are in very critical health conditions, would typically come to the intensive care unit. The patients that we typically see are patients who are in respiratory failure or multi-organ failure, livers are failing, heart failure. We typically get to see and treat those patients in the ICU.
So, the beginning of this pandemic, the last 2 months, you have been engaged. Can you tell me what your experience was at the ICU? And I'm suggesting or maybe thinking that is where you go or where you got infected. So let's start. How was the ICU unit? And I want to note that Prince George's County ranks as one of the highest, has the highest level of COVID infections. The latest statistics, 10,791 persons were infected in PG County. And it's important to note that many Cameroonians in Maryland live within the PG County area. The next was Montgomery. Montgomery had 7,759. Then you had Baltimore, 4,399, and Baltimore City, 3,606. These are all areas where Africans, Cameroonians, live, and we ourselves have lived the experience. There are some of There are many people that you only heard that they got infected. You call and you just say, "Well, I'm just calling to check." But people are not willing to, let me say, release their status, and that is fine. That is their right to it. So I just want to. What was the experience for you on in the ICU unit when this started off?
So, Lambert, like a lot of places with this virus, we never knew how this was going. We knew it was going to affect us one way or the other, but we didn't expect this magnitude of it. But we did prepare. By preparing, we had to do a lot of reshuffling. We had to do change a lot of our treatment paths, admission paths, or our workflow for the unit had to be changed. The criteria for admission into the ICU had to be slightly altered. We had to boost staffing. There were so many things that we had to do on the back end, and of course, you had to see what other hospitals were doing, and then try to adapt to what you are able to do in your own particular hospital, in your own unit. Um, I will tell you, Lambert, that my hospital was hit pretty quick and pretty bad. We got to see a lot of patients in a day. We would admit um, 16 to 20 patients at a time in a day. There would be patients waiting to come into the unit. Um, it was very scary in the beginning. Because we had to, just like with other hospitals, we had to hold visitation. We didn't have family members coming in. And you would see a patient come in and literally on their deathbed, and there was not much you could do but stand there and really hold their hand and maybe call their families on the phone to, say goodbye to their loved ones that way. Um, it was a very, very humbling experience, I'll tell you. Um, Doctors, nurses, respiratory therapists. I have never seen members of the healthcare team come together like the way they did with the onset of this coronavirus and work together cohesively as a team um, to make sure that the patients were okay. The nurses became um, pastors, prayer warriors, what have you for the patients because that's all that they had.
So I am just imagining how, I mean, we're going to talk later on about this is also Mental Health Awareness Month, and I'm sure a lot of that stress and all of that. I want to zoom in on given all the changes that took place. Were the nurses, the doctors able to maintain the very criteria, the very things they asked us to do, hand washing, social distancing, which in fact is physical distancing? Um, all those things that they were you able, because I know that there was a time when with the hospitals or nurses started complaining they didn't have personal protective equipment, they didn't have the gloves, they were now sharing, had to keep on masks for longer periods than we anticipated. What was your experience at the hospital?
So we were fortunate that we took on and we paid attention to what was happening nationally in terms of PPE shortages. So whatever we had, we tried to make sure that we mitigated that and made sure that the staff had and we, the nurses, had enough PPE appropriate enough to work. And so, yes, there were issues and there were little challenges that were not alarming and were able to work through. But in all, the staff did have PPE. We had PPE, enough PPE to work with to care for our patients, and that we were fortunate enough about. We maintained hand washing. I would tell you that uh, the nurses and the doctors and a lot of the healthcare workers came out with very, very dry, peely, scaly hands during this period because everyone was gung ho on hand washing, which is the number one thing to prevent the spread of any infection is hand washing. Um, and they held each other accountable for that. It was difficult in the beginning to always wear your PPE from when you come on the shift and only take it off when you're going to the bathroom or you're going to take a break. A lot of the nurses develop pressure sores on the bridge of their noses because of putting on the PPE for extended periods of time. And just like you said, it played a lot in their psyche, but they were, I have to give it up to the nurses. They really, really did what they had to do, and not a single complaint.
So again, I'll put this in context. Like I said, welcome our viewers, welcome everybody. We are celebrating the hard work of nurses across the globe. We are joining the World Health Organization in celebration of the Day of Nurses. In fact, it was the Week of Nurses was celebrated May 6th through May 12th, and May 12th happens to be the anniversary of the birth of one of those who is considered the pioneer, the founder of modern nursing, that is Florence Nightingale. A British woman who helped out during the Crimean War in the uh, 1800s. And her birthday is the 12th of May. And every year, the world celebrates that as World Nursing Day. So we are joining the nurses to say thank you in our own little way. And on set with me this morning is Mrs. Judith Ballon, who is a nurse manager in one of the hospitals here in Maryland. And I want to now move over to, I mean, over the last 3 weeks, I've talked about home therapies. I've been having a friend, Michael Boyo, who's in Nigeria, talk about different issues. I'm hoping he's going to come on set today. But Judith, I was kind of shocked when you sent me the message to say you yourself, you are a survivor. Tell me that story. How did that happen?
Lambert, one thing I would say, and another thing that pushed me to come on here, is to encourage anyone and everyone to pay attention to their bodies. Um, I am a typical one of, if there's any aches and pains, I always find an excuse for it. I worked too hard, or I just worked out or something. And I was feeling some body pains, which I attributed to having worked very long hours the previous weeks or the last previous couple of days, and so really didn't pay much attention to the typical signs. I didn't have, except for the muscle aches at the point. I did feel sort of feverish, but again, I attributed it to a change in weather. It was cold and then it was hot. I made excuses for that, but as the week went on, I started having or experiencing some shortness of breath. And all the while, I didn't have a temperature. And I remember telling my colleague, I said, this may be nothing, but I do feel like there's something going on and there's something wrong with me. And she said, well, why do you say that? I said, well, really haven't been feeling myself for a couple of days. I probably just need to take a break, And so we had lunch, but then I was unable to get off from the lunch table to my office. Again, I attributed it to, I may have gained a lot of weight or I may have just eaten too much. But then my nursing hat kicked in, and I had to take hold on a second and say, listen, Judith, you need to stop, because this is not normal. It's not normal for you to have any shortness of breath because you have no pre-existing conditions. You've been feeling very tired, very feverish with body aches. It's probably time for you. You need to report this. And so I called our employee health department, and I was redirected to go get tested. And unfortunately, I tested positive. Um, I was in tune with my body, and I knew that there was something wrong. A lot of us Africans, I would say, we have the tendency of um, pushing things aside, brushing things aside. We have multiple jobs, we have bills to pay, multiple responsibilities that are usually not supported by just one job. And a lot of us have multiple jobs. So you make up, we typically say, I don't really get time for sick. I don't have time to be ill. I don't have time to be sick. Um, and we tend to brush little things off, which could make, or which could be something that is more serious than we really know. So I came back home, called my doctor, got some treatment ordered and sent to me at home. But I also took some home remedies. I was
Okay, so Judith, I appreciate that. Just before we get to that point, I appreciate the fact you're able to say many of us are not in tune with our bodies. We want to make excuses. It's fatigue. Okay, you want to give a reason for why you are feeling the way you are feeling when you have the opportunity to be able to go check to make sure that this is not what you are thinking. And again, I mean, maybe your experience is different, and I'm sure it's different. Everybody's experience is not the same.
Mhm.
Were you afraid to go do the tests? What was your experience? Oh,
So I was afraid, but I needed to know. I needed to know because of the people that I was around. I needed to know because I needed to be sure that I kept my family safe.
and again,
I needed to know because I needed to keep anyone that was around me safe. This was more a public safety issue than really more for myself. Yes, I needed to know and I needed to take care of me, but I also had to take care of those around me. Um, I didn't want to be the one responsible for making a thousand multiple people sick if I had the virus and I didn't get tested and got treated for it.
so again, public safety number one. I mean, personal health, but then you're also considering the population, and that is why you had to go take the test. I don't know you as one of those who visits many of these places in the neighborhood that some of us visit in Maryland. I know people who have said there are too many. There are too many Cameroonian-like places in Maryland that it resembles Cameroon. I know that people lived in denial for a while. Your experience as a nurse talking to people who came in, was that something you encountered? Is it many people did not take this as seriously as before, and then we got hit as a community? And I'll say that
Yeah.
the Cameroonian and African communities have been greatly hit. I mean, even though they talk about you, when you listen to the news, you watch the news, everybody's talking about um, pre-existing conditions amongst black people. I mean, poverty is a pre-existing condition. Let me put it that way. In addition to that, if you have diabetes and all that, you are predisposed. But I don't think that is just those conditions. One of those pre-existing conditions is the denial. And most members, or let me not exact, many members of our community, you know, were in denial for a while until they started seeing others going down. Then again, I don't know whether that was your experience.
I'm gonna say this, Lambert. In our culture, um, we tend to live as a community. There is nothing as go and be over there by yourself. We don't know that in our community. And so this is something that was very, very difficult for us to understand. What do you mean by self isolate? That's not something that comes naturally to anyone. And even more so, it'll be a lot more difficult for us because that's not in our nature, that's not our culture to self isolate. And the denial comes in too. I'm healthy. That doesn't have to, that's not going to happen to me. That's not going to touch me. That's not going to happen to me. Um, but a lot of us are healthcare professionals and we work in different places and we don't know how this thing gets, how you can get it. You could be the best person, um, following the proper PPE, donning and take putting on and taking off the PPE correctly. You could be using your hand sanitizers. You could be washing your hands as often as possible, but you just don't know how you contract it. And a lot of us live with elderly people at home. Nobody knows. You could go to the store to go get something. You could go anywhere and get this virus. Um, it is important, like I said, there are people that do not carry this virus and you see on them that they have the virus. That's one thing that we have to put out there. They're asymptomatic carriers. So I would always say treat everybody as though they had it because you never know.
Yeah. So again, Julie, you touched on something, and I want to go back to the. I mean, before you got tested.
Mhm.
I mean, have you been able to retrace your steps? And I mean, I don't know whether you know how you got infected.
I couldn't really tell you because I tried the first few days laying in my bed. I tried to retrace my steps, and Yes, my unit is completely a COVID unit. But I did not have very much contact with the patients. I did have nurses come in and out of my office. I can't really pinpoint where I picked or where I got infected. And that's what I'm saying is sometimes it's very clear. I went to this grocery store on this day, and then 2 days later I started having symptoms. But you know and then again I try to think back, was this, when did I start having symptoms? Where was I how many days ago? It gets all jumbled up, and it's just, you don't it's hard for me to tell where I got it from. And thankfully no one in my house exhibited any symptoms, and I was very grateful for that, because that was my number one concern, was that I don't get the members of my family infected.
Right. So then you got tested. How was that? How was that experience? What was it? I mean, how do you get tested?
So it was what they call a nasopharyngeal swab. They had I'm gonna call it almost like a Q-tip that they inserted all the way into my nose, all the way to the back of my nose, almost touching my throat. And that was sent off to the lab, and that's how I got tested.
How many days? How long did that last? How did the experience?
So it I got my results in a couple of hours, because there are very many different testing centers. Because I got tested in the emergency room of my hospital, I was able to get test results. And also because I was experiencing shortness of breath, there was a concern there that I may have been developing pneumonia, but thankfully everything was okay.
Good. So then you got the results. I know
Then I got the results.
you're married.
Yeah.
I don't know. So what was the experience at home?
So I had to call my husband, and I told him, I'm on my way home. I tested positive. You're going to have to move out of the bedroom. We had to do a lot of restructuring at home before I got home. Got home and went straight upstairs. And I was, quarantined in my bedroom. They, were able to bring me food upstairs, and they, among themselves at home, maintained social distancing. Everybody sat at different corners of the house. They would still talk, but they sat at different angles of the house, and had conversations and had their meals. Everyone had a time when they came to the kitchen to get their food. But I mostly was in my room, and they brought the food up to me and came and took my plates away. I started using disposable plates, disposable spoons, disposable cutlery, just like was recommended by the health department.
So you also mentioned the fact that you called your primary care doctor and they gave you some medication. What medication did they give you?
So the medications that were given were mostly for symptom management, because, like we all know, there is no treatment for this virus, no cure. So for whatever symptoms I was exhibiting is what my doctor prescribed medications to me for. And I would say the bulk of it were vitamins. Um, she asked me to start taking a lot of vitamin D, a lot of vitamin C, because I was having fevers. I started experiencing fevers, very high temperatures. And so she asked me to take some Tylenol for that. And then also, because I had shortness of breath, she also gave me an inhaler and some antibiotics, just so I didn't get any progression to pneumonia. And I took an inhaler for the shortness of breath to help me out as well. And so those together with I believe our traditional ginger and garlic and things kind of helped me pretty quickly.
Good. So I want to, pivot to
Hmm.
that. So you took the Western medicine or modern medicine, and in addition to that, what did you take?
So we had a concoction that we used all the time: ginger, garlic, onions, and then we added turmeric in it, and then we also added lemon juice at the end of it, and lemongrass. We call it fever grass. So our regular boil for a day would be lemongrass, ginger, garlic, onion, and then everyone added turmeric and lemon juice when they were about to drink it, and some honey just for some taste. And we drank that morning, afternoon, evening. Everybody drank that. That was our tea at home.
So how long ago was this?
I mean, it's still ongoing. This
I
we
mean,
started.
when you got tested?
It's been 2, 3 weeks now.
Good. So you got tested, and then you have been quarantined for 3 weeks.
For, well, 2 weeks. I'm off
Okay,
quarantine now.
good. So how are you feeling now?
Much better.
Okay.
I'm doing very much better. I still cough every now and then, but it's not terrible. I do experience some shortness of breath when I overexert, but it's not anything that will not clear up within a couple of days. And so it's one day at a time, Lambert. But I
So
am
you
so grateful. I am so grateful.
good. So again, Judith, I am very, very grateful to you. And I mean, when I made the announcement on the forum yesterday, on our church forum that you were going to be on, you saw the overpouring of messages of
I
goodwill.
did.
And
Yeah.
again, like I said, you embody the African nurses that we know, and all nurses, but in particular the African nurses, because we have a
Thank
different
you.
and additional stress. Something that
Yes.
you mentioned here, which is something that I really wanted to talk about, the fact that I mean, given the bills that we have, many people take on other jobs, they take on long hours just because they want to make that meet. And so that brings on an additional strain, you
Mhm.
know. So I'm wondering, these 3 weeks or so that you have been away, I mean, dealing with COVID, have you really rested?
Yes. Yes. I have, Lambert. I have. But then there's an additional stress. You can't just be quarantined. You have to think about your home, right? You have to think about going back to work right away because you have other responsibilities waiting for you. But those 2 weeks that I was quarantined were my most restful weeks in a very long time.
So how were the symptoms playing out? I mean, did you have all of them in one sitting, or in
No.
the morning you had this, in the afternoon, then in the evening? How did this play out?
So, the shortness of breath mostly occurred when I was out of bed, doing anything that would cause exertion, just getting up out of bed to walk to the bathroom or walking around my room, and I'd be so severely short of breath. Or maybe if I had gone down to the kitchen when it was clear to get a bottle of water and there was nobody to bring me a bottle of water, just going down those steps and going back up those steps, and I would be so completely wiped out. Um, but I had the coughs usually and the fevers in the evening time. The body aches were there, but they seemed to intensify in the evening with the fevers and the chills that I experienced. My worst times were usually the evenings from about 3, 4 o'clock until about 9 o'clock in the evening. And sometimes in the middle of the night, the fevers and the chills would wake me up. And those were really the times when I struggled the most.
So, Judy, I mean, I may be getting too personal, but how did you deal with this downtime? Let me put it downtime. I mean, let me put it this way. Many people have advocated that one of the ways in which to avoid the stress or to de-stress yourself is to avoid watching TV because of all the bad news that you see there. Too many complaints. New York comes up, California comes up. Then you hear about Italy, you hear about Spain. So how did you deal with watching TV or watching news?
Honestly, I don't have a TV in my bedroom, and I didn't watch the news. Even before I got sick, Lambert, whenever I watched the news, I got increasingly anxious. Um, Anxious because we just don't know. We don't know how it's going to play out. And when you hear about there's a national shortage of this, there is no this, and you start taking stock of what you have, and you're like, oh my God, what if, and then fear sets in, anxiety sets in, and then your emotions are all in disarray. And I stopped watching the news altogether. If I needed to hear something, my husband would usually tell me, or my brother would say, oh, it's this now. I kind of banned them from telling me how many deaths we had because I experienced that firsthand in the hospital. I just didn't want to hear it again. I didn't want to hear it. And they say, there is bliss in not knowing certain things. I don't know if I'm saying it
Mhm,
right,
mhm.
but there's bliss in not knowing. And honestly, with me not knowing and not really following up, and not really keeping tabs like that, helped me a little bit, because I was like, I don't know what I don't know won't really stress me out mentally, because then you're thinking, oh my God, how are these patients doing? How are their families taking it? This is terrible that we're having these many deaths. And then you're thinking to yourself, and you hear, oh, there are people that are testing positive, then they get better, and then they get sick again, and then they're dying. And then I start wondering, is this just a grace period that God is giving me to get my affairs in order before, and all of that plays in the back of your mind. So it's a different level of stress at that point.
You now touched on something that I wanted to come to, but what about the spiritual part? Did your spiritual life? I mean, uh, look, there's a time when you lock yourself in and you are like, is this what death is like? I
Mhm.
mean, just being by yourself and you all that you relied on. You have a husband, you have a brother, you have a family around you, and you are now locked in by yourself. You can't even help yourself as a
Yeah.
nurse.
Yeah.
You who devoted your life to help others, you
Mhm.
are now in need of your life. I'm wondering, did you turn to your spiritual side
Of
to tap in
course.
some energy for
Of
this?
course. Of course, Lambert. Of course. Um, I'm gonna say this. I'm very big on prayer. And so during that time, I said my rosary more than I have ever in a long, long time. I prayed the Divine Mercy prayer, the chaplet at 6 a.m., at 3 o'clock, and whenever I was awake in the evening time, when I woke up in the middle of the night, I said it. Um, but there was always a calming. I always had a sense of peace that this was not how it was going to end for me. Uh, for whatever reason, it could be from the comfort of my prayers, but um, that helped me through a lot. And I must also give credit to my family. They would knock on the door and say, hey, we're here, we're thinking about you, praying for you. I have phone calls from my family as well, and also the Holy Trinity Choir. Not a lot of them didn't know I was sick until I told them, but they kept me going, and they always said, we always said our prayers, we always played with each other and talked, and that really kept me going and looking forward to the future.
So, if I may ask, what lessons have you learned from this being a nurse? What are some of the new things that have maybe empowered you as a nurse or challenged some of your assumptions?
Nurses are not invincible. um, as a nurse, you will be a patient. You have to take care of yourself. You have to be healthy to be able to provide the best possible care to your patients. Without you being healthy physically, emotionally, mentally, you cannot give 100% to your patient like you should, let me say. Um, Take time to take a breather for yourself. A lot of us nurses don't know how to do that. We don't know how to take a step back and say, this is my time. I'm going to step back and breathe and drink some water and eat lunch for 30 minutes. We don't know that. We find it very difficult to do. But if I were to say anything, is step back away and take some time for yourself. Do something for yourself. I'm learning to do that now.
So I know you mentioned at the beginning that you are a nurse manager, and for me, I believe, I mean, you manage nurses, and I'm wondering, what are some of the challenges that I mean, you have been away from the unit for 3 weeks, but in your experience as a manager, what are some of the challenges that nurses face in the hospital in addition to what COVID has brought in, especially being an African immigrant nurse?
Very loaded question. But a lot of, the first thing is transparency, right? A lot of nurses in the beginning would think that, or would not be very clear as to the path the organization is taking to keep them protected from the virus or from whatever situation is. And also, like a lot of places, staffing challenges, not enough human resources to be able to do the work that is expected of them to do. Uh, and also the general issues that we had nationally, which was the PPE issues. And I must give credit to my organization that they did an incredible job with trying to make sure that we had enough PPE and eventually resolved or are working on a resolution for the staffing challenges and everything else, but it's usually a fear of the unknown. um, we work, I'm going to say we nurses work in very many different institutions. Whatever is done in institution A is going to be different from what we do at institution B. And so we tend to compare both institutions and what they're doing in there. And then one institution usually gets the shorter or usually gets to say they're not doing what they're supposed to do for their nurses, which is not very true, because whatever they're doing, they're both providing the same kind of comfort and both kind of safety net for their nurses, just in different ways are in different ways based on their policies and organizational values. And so that right there is something very difficult for us, because we tend to do a lot of comparison on what is being done in A, it's not being done in B, it's not enough as what C is doing, and that brings a lot of confusion and a lot of mixed emotions. Let me put it that way.
Yeah, yeah. So, I mean, yes, with all different organizations, all doing the same thing, isn't it? But taking different approaches, and that brings me to the thing that you had on, which is, hey, I had my medications. I was able to get tested because you are not the typical, put it, African immigrant. You were lucky. You are a nurse manager working in a hospital, and when you called, you got tested. That has not been the experience of many people, because people, you have to go to call your doctor. The
Mhm.
doctor has to give you notification or whatever, a referral. Then you call the place for testing. And I mean, maybe things have changed now. But let me say this. You just mentioned four ways by which you handled COVID 19.
Mhm.
One, you took your medication. Two, home remedies. Three, you had, I mean, spiritual energy to fight it off. And four, you had your family. But
Mhm.
I'm very particular why you had to take your regular medication and then add to that the home remedies. Were you not confident that what the doctor prescribed was enough? Why did you have to go again to do home remedies?
So the home remedies to me were more for boosting my immune system to fight up the virus. Because I know that there is no particular cure for the virus, and whatever medications I was taking were mostly just to manage the symptoms that I had. Um, eh, my mom always told me, if it doesn't hurt you, take it. Nothing natural will kill you except in excesses, right? So,
Mhm.
so I still always believe that there is always room for um, our natural remedies, because they're naturally occurring for a reason, right? So there has to be some medicinal gain to them. Um, I felt comfortable with taking to boost my immune system, because I did believe at the time that my immune system was low, and I needed to take them to boost my immune system to help me fight off the virus, while using the traditional medications to manage my symptoms.
So if you had, I mean, the people who are maybe focusing only on the, call it home remedies, what do you have to say to them?
Um, yes, you can take home remedies, but please reach out to a doctor. Um, a lot of times their medications or the symptoms that we're experiencing have the symptoms. For instance, someone who's experiencing shortness of breath does not take that into consideration and does not treat that appropriately, could end up in an intensive care unit bed. and that's something that could be avoided. I would always say call your primary care doctor. There are some urgent cares, there are some doctors or family friends or people that we know who can refer you to somebody who knows somebody. You mentioned about testing. It's much better now, and people can get tested. If you call and you do have symptoms, they will test you. There are different, very many. I know the University of Maryland system, they have a hotline where the members of the community could call and get information on the COVID-19, and also testing if they're experiencing symptoms and all of that. They can call that hotline. Unfortunately, I do not have it with me. They can call the hotline and get accurate information. And also, if they need testing, a lot of times they would send them to be tested at a local testing center. But there are a lot of places that are offering free testing. There is an urgent care in Greenbelt that is offering free testing. I think it's called ACE Urgent Care, if I can remember very well. But they offer free COVID-19 testing. It is a wait, but they do offer testing there as well.
So, Juliet, I know you may not have had experience talking with people in Africa, but if family member called you from Cameroon and the different things that what would be your advice to a lay person in the street in Cameroon, anywhere in Africa, who is hearing about COVID-19 and needs help beyond what the government is saying? What would be your advice as a nurse?
Social distancing, hand washing, hand hygiene, and wearing the mask in public areas. I cannot stress this enough. I know that we tend not to do these things in Africa. I have seen videos, especially in Cameroon, of people not adhering to these things. They do wash their hands, but go around as if nothing is wrong, nothing is going on. They're in crowded areas. There are no masks and things like that. It is scary, Lambert. So I would tell them social distance as much as possible. If you don't have to go anywhere, stay in the house, which is difficult. If you have to go anywhere, put on your mask, put on your, wash your hands regularly, and keep away, but put on a mask if you're going to be in a crowded area, and try to keep a distance between people and yourself as much as possible.
Difficult, but worth doing. Now, let's pivot to the future. COVID-19 has changed life for everybody.
Yes, it has.
And everybody is like, what is the future like?
This
As
is
a
our
nurse,
future.
what do you envisage in the days ahead?
This is our future, Lambert. We will never know life like the way we knew it before. Um, our social gatherings, our carefree, we will not know until we have a cure for this virus. We will not know life like the way we knew it before. Um, things, governments may open up, states are opening up. Um, we worry about a surge in the number of cases. Um, the only thing I would say is hand hygiene, social distancing as much as possible. If you don't have to be hugging, close contact or whatever with anybody, then don't. And always put on a mask when you go out. This is going to be our future, Lambert, in my opinion.
So yesterday when we talked, you had gone back to the testing center. I was wondering, is that something you can share? Is that something you can talk about?
I went to get retested, and I'm still waiting for the results.
Okay, so this time around you went somewhere else. Okay,
Yes,
so but you're feeling healthy. Are you thinking of going back to work anytime soon?
absolutely. I'll be going back to work pretty soon.
Okay, so Judith, again, like because we are celebrating this week of nurses, one thing that I really wanted you to share with us is why did you get into nursing and how has this journey been? Because I know how you started and how you went around before. So why did you get into nursing and how has the journey been?
Um, I knew I was going to be in the healthcare field, but coming here, I wasn't able to pursue medical school like I thought I was going to, or pharmacy school at the time. And so I got into nursing to pay the bills. But then I fell in love with it because it was sort of my personality. I love helping people, being of service. And that is what nursing is. Nursing is a selfless profession. Um, and I had an experience with a patient, an older patient, and it sticks with me till today. This was in 2009, and very elderly, and she had just come into the nursing home. Her family had abandoned her there, never been by to see her. After a couple of weeks of being in the nursing home, she came in, I admitted her. And then a couple of weeks later, we were sitting and she was having dinner, and I was giving her her medications, and we were chit chatting. And she looked up to me and said, I have come to terms with the fact that you are my new family, and thank you for taking care of me. And that stood out, that stuck with me. um, because when you treat patients, to me, I don't look at them as patients anymore. I look at them as, this could be my brother, this could be my mom, my dad, my grandmother, my grandfather. And it gives you a different, it gives, well, for me, um, um, there's something different in the way I care for my patients when that comes to mind. um, and so I couldn't see myself doing anything other than nursing, Lambert. I really couldn't. Long-term care, I've worked in the long-term care portion of nursing. I've worked in the pharmaceuticals portion of nursing, and currently in the critical care setting, and been doing this now for over about 11 years, and I would not choose a different career over this.
So how did you become nurse? Just for the sake of those who want to, because
Sure. I started off in as a licensed practical nurse in 2009. I started off my career in Houston, Texas, and then I did an LPN to RN program in Texas. In 2012, I became an RN, and then I continued to get a BSN online. I did that online still in Texas. And then I graduated in 2014. And then I'm currently doing a master's program in nursing.
so you have moved across all that. So there's a hybrid. You actually went to a campus, attended classes
Hmm.
in person,
Hmm.
then switched over to online, and
Hmm.
maybe did a hybrid of in person and online,
Hmm.
and
And then
now
online.
now you are fully online. So one could say you are both a student and a nurse at the same time. How
Correct.
is that going? How is that working?
It has its challenges. Um, Being that we do work long hours, we work 12-hour shifts. Uh, Once you come back from work, you have to carve out time for homework. You have to carve out time for papers. You have to carve out time for seminars. Have to carve out time for your family and for you also. So a lot of times we get the shorter end of the stick and not carve out time for ourselves, but we do for everyone else. First things, you have to care for your family, and then make sure that you do your schoolwork, and then still be able to make it up to work, and take care of work. It's a difficult but doable juggle.
So are you going to? I mean, maybe the ICU is where you are currently focused, but at the master's level, are you getting some particular specialization? What is it you are really drilling down to at this point?
um right now, I don't know, Lambert. I may stay in the ICU. I may decide to branch off, doing something else, but as of right now, I don't know where this is taking me to. It's a journey, and I'm enjoying the ride for now. I'll see, probably in the next year, by the time I graduate, I'll know what I want to do with my degree.
So lots of people, I mean, let's talk about something that, I guess we mentioned in the beginning, but this is Mental Health Awareness Month. And that's another area where our community is not really big on,
Hmm.
but COVID has brought an additional, call it stress.
Hmm.
Um, in addressing a community like ours, what are some of the challenges in the mental health area? And I'm linking this to your, I mean, you have many areas that you could, because I see many people are becoming nurse practitioners and getting into psych nursing
Mhm.
because, well, I mean, I work in a within the psych industry, and I know that there's a lot of money there for psych nurses. But I'm
Mhm.
wondering, what are some of the things that you, as a nurse, getting telling people who have issues with, let me say, psych issues? Everybody would have issues of stress at this point.
Mhm.
There are issues of depression. That many people are depressed just because they can't go to work.
Mhm.
There are many people who are depressed just by staying at home all day long. I had my daughter, who is 9 years old, wake up 2 days ago crying, telling me that she misses her friends. She wants to go to
Mhm.
school. So how would you manage this within the context of your experience?
Lambert, and it's a part of reason why I did this. There's a lot of stigma that is being attached to patients, people who have COVID-19. I want to take that away. Okay. This doesn't define who you are, it doesn't make you, nor does it break you. Um, we're losing a lot of people, but if you're going through it, there's no reason why you should go through it alone. Not to burden other people, but just to have that support. It's very important to have support. It's important to have people to call and check on you. It keeps you going, and it does keep you going. It gives you a reason to fight. It gives you a reason to wake up every day. You know, no man was built to be an island. It's always important to have a conversation with somebody who can make a difference to you. It doesn't matter if they call and check on you 2 seconds or 2 minutes, a minute, or whatever. A phone call. We use WhatsApp all the time. A quick video call. I'm just calling to check on you. That goes a very, very long way. And it's okay. It's okay to say, hey, I have been infected. You can't come to my house, but we can talk through FaceTime. You know, it's not a stigma. It's okay. Talk to someone, tell someone, say something. Don't suffer alone.
Yeah, but
Don't
I mean,
suffer alone.
I hear you, but in a community like ours where people celebrate failures, or where people celebrate, call it misfortunes or perceived misfortunes, I guess a lot of people tend to want to shelf their problems, want to keep them to themselves just because they're afraid telling the next person may it may become the next person may blow that out to the community. Because I think a lot of the problems that and I mean, I really want to say, before Judith, I really applaud you. I want to say thank you, because it's not easy for anybody to just come and say I had COVID-19. People may take it and think that it's an easy thing to do, but I know many people. I mean, people that, hey, none of them has ever agreed that they have COVID-19. I have not tested, but maybe I've had the symptoms over the last couple of weeks and really just been lucky that maybe I also took some home remedies and I'm feeling better. But to be able to come out like this in a public setting to declare that I'm a nurse, I got infected, I'm recovering, I'm feeling better, it's great. But there are many people in our community who would die with it and just prefer, just to say, no, this is not something that I want. And I love the way you put it at the beginning. This is for me. The reason why I wanted to get tested, that is you talking, was I wanted to be sure. I did not want to be the one to infect others.
Mhm.
And I think from a mental perspective, that is something that our community needs to embrace.
Yeah.
That community education, to be able to say that I have gone through this. This is how I dealt with it. It may not be the same for everybody. I just think that our community needs to wake up,
Yeah.
be aware of the mental challenges. We are already in a stressful environment, and any
Yeah.
little thing that adds to that stress makes it worse. So I don't know what your sentiments are with respect to that.
No, I completely I agree with you 100%, Lambert. We need to grow up. We need to wake up. We need to not make in matters any more worse from for others than it is. We're all in this together. And they always say, what happens to A, you never know what's going to happen to you. It could be 10 times worse. And you don't want to be in that position where you can't seek help because you made fun of somebody else, or negatively talked about somebody else who was sick, and then all of a sudden you're stuck and no one is there to help you. I- Petty, petty, petty. That's what I would say. And it's not, this is not a community that should engage in things like that. We should support each other more than ever now. And I completely applaud the CCWDC for what they're doing for the members of their community. But I always say that it goes beyond um, just that, call each other, say something to somebody, say, hey, I've been sick, I really appreciate if you could call me. And if you say, hey, I'm a call, please keep that promise to call them, even if it's a 10-second phone call a day to say, or every other day to say, I'm thinking about you. It goes a long way. We should be each other's keepers, and we should be there for each other regardless of what is going on, petty.
Yeah, so you just mentioned, and just for the sake of those who do not know, you mentioned something about CCWDC. What is that, and what is it they're doing?
So the CCWDC is the Cameroon Catholic community in the Washington D.C. area, metro area. They a church group. We identify ourselves by our Catholic faith, and we um, meet every last Sunday of the month. And they've recently had a fund where families that have been affected by COVID will receive someone. They'll reach out to them and provide encouraging words, words of comfort, words of support, and give just a fund to help them, just to give a little bit of a cushion to them, and make them feel like they're part of a community, a part of a family, to say. Um, and there are a lot of groups doing this, and this was a good idea. This was a great thing that happened and continues to happen, and I truly applaud them for that.
So again, ladies and gentlemen, I want to thank you, Judith. There have been an avalanche of greetings across the community. There are many people: Divine Angie, Lazar Shadzeka, Mayon Tabe, Father Morris, Marilyn Dua, lots of your friends, Fronix Day, lots of them sending greetings your way.
Thank you.
And they say they are praying for you and they are happy that you are feeling good and getting better. Looking
Thank you.
forward to you coming back to the community.
Thank
I
you.
again want to say a very big thank you. The program this morning was dedicated to nurses, especially African immigrant nurses and who are on the front line. Judith is a nurse who works in an ICU unit and became infected 3 weeks ago and was in isolation and has been able to beat COVID. And we wanted to say congratulations. We want to say thank you. And as like I've said throughout the program, you are an embodiment of all the nurses, our
Thank you.
mothers, our sisters, our wives, our friends, you know, the temptation is always to think that nursing is a female thing, but we know that there are many men who are nurses doing a great job,
Absolutely.
and there are many of our friends who are nurses. We wanted to take this opportunity on this program to say thank you. It may be just words, but know that we are grateful. We are comforted by the fact that you chose this profession in order to take care of us and take care of others.
Mhm.
We want to wish you well, wish you the best to continue. And I just wanted to put a pitch that think about the fact that nurses deal with blood, and blood, that is what Christ offered, his life. And that life that Christ offered is what has saved all of us. The nurses who get to deal with this on a daily basis are dealing with life and saving people. I want to say that even if the world does not recognize you don't get paid enough, let these words that you have received from across the community, from across the globe, be your pay and your word of encouragement. Every time you feel like dropping, you feel tired, you feel worn out, you feel despised, think about these words of thank you. We want to say thank you to all our nurses. We continue to appreciate you. While Nurses Week is over, we say Nurses Day is every day because you get up and go back to work and take care of us. Ladies and gentlemen, I want to say a big thank you for all those who watched. We're going to be back again next week. Judy, do you have any last words?
Thank you, Lambert, for this platform. I want to use this opportunity to say a very happy Nurses Week, though past, to my fellow nurses. And I want to encourage us to maintain social distancing, keep doing hand hygiene, and put on a mask if you have to get out of the house. At all costs, make sure you have a mask, wash your hands, and stay safe. Thank
So
you.
again, thank you very much. And you must have you're listening there to Judith Ballon. I mean, across the last 3 weeks, we have been dealing with COVID-19 in Africa, and you touched on a lot of the things that we're saying, which bear, I mean, they're worth repeating. You know, symptoms. You took some of the medication because of the symptoms, isn't it? You targeted the symptoms. There's no cure. Second thing that you said, you enlightened us on today is this is not a death sentence. Okay, you had COVID, you are now feeling better, you're feeling well, you are talking to us. COVID is not a death sentence. You know, in fact, I think the statistics say just a small percentage of people with pre-existing conditions are those who, really get bad. And thirdly, you gave us a bunch of things that we could do, and I'm happy that you really mentioned something that's dear to my heart, the home remedies, because I read this week, the Washington Post put out a very beautiful article this week that doctors are continuing to discover every day different things or different ways in which COVID impacts the body. Before they thought it was just pneumonia, and that's why we are all running around and crying about these breathing machines.
Mhm.
Then they found out some other things. And my dear friend who was supposed to come on today, um, Michael Boyo, to talk about turmeric, talked about, I mean, he indicated that turmeric is able to block the entrance passages for the virus. Okay, so turmeric is key in combating COVID, and he was going to come to explain why that is the case. I mean, over the weeks we have talked about other things. I'm going to arrange that in the course of the week. Again, ladies and gentlemen, if you know a nurse, just as when we go around, we see soldiers in uniform, we say thank you for their service. We should also start doing that for every nurse that we meet, for every nurse that we know. I know that having been a teacher, every time that a student saw me, they say thank you for those who appreciate the services. But we all owe our lives, not just to ourselves doing what we are supposed to do, but to nurses like Mrs. Judith Ballon taking care of us and coming us to inform of what is going on. So, Judith, thank you. And
Thank you, Lambert.
enjoy your weekend. I'll
Thank
see you
you.
next
You do the
week.
same.
Good. Thank you.
Thank you, sir.